everyone, my name is Dr. Pamela Muga, a consultant obstetrician gynecologist working in partnership with Ponea Health, and today we're going to discuss miscarriage. Miscarriage is medically defined as loss of a pregnancy before the baby is able to survive outside the uterus. So the commonest cause of miscarriage would be genetic issues. So a problem with the genetics of the pregnancy that you're carrying is likely to cause a miscarriage. Infections, there are certain infections that would predispose you to getting a miscarriage. Any endocrine disorders or hormonal disorders, so things like diabetes, thyroid problems, chronic medical conditions, like if you have kidney disease or certain cardiac diseases, might cause you to get miscarriage. The age of your parents, for both father and mother, anybody who's over the age of 40, there's a higher likelihood that you are likely to get a miscarriage. Problems with the uterus, so if you are born with the uterus that's not well formed, you're likely to suffer from miscarriage. Certain people have a cervix that's not quite as tight as it should be, and so you end up going into labor very early in the pregnancy, and that can lead to miscarriage. Exposure to chemicals, hazards, or radiation, say from work. If you work in a factory, then that can predispose you to getting miscarriage. And then also lifestyle issues, so things like smoking and taking alcohol can predispose you to getting a miscarriage. So a miscarriage can be handled in basically 3 ways so far. We can do something that's called expectant management. And this tends to happen if your pregnancy is pretty early. We can allow you to wait it out, and most of the time, once the pregnancy has started to be lost, then your body will expel it on its own, and you can be given that time, about 2 weeks or so, with regular checkups at the hospital. There's also medical management of miscarriage, where we actually give you certain medications that make your uterus contract. So this tends to happen once the miscarriage is diagnosed, and we'll give you certain medications that you'll probably take orally, and it will cause your body to expel the pregnancy. And then the surgical management of miscarriage. So in this particular situation, we'll take you to theater. Likely you'll be given something to stop the pain, and then we actually go in and remove the pregnancy from your uterus. So during the management of the miscarriage, then the biggest risk would be bleeding. So if you're bleeding significantly, then that's the biggest thing. So we try and control, give you certain medications to prevent you from bleeding too much, and then also try and carry out a good procedure so that the bleeding actually stops and you don't get anemic afterwards. Depending on the miscarriage, sometimes that is the way that we tend to diagnose certain medical conditions. So even when you keep having it, then there are certain tests that we will do to try and find out whether you have any medical condition that's predisposing you to getting those miscarriages. So we'll tend to investigate it and just try and find out if the reason for the miscarriage. But having one miscarriage doesn't necessarily mean that all your future pregnancies are going to be miscarried. Once we find out the reason, then there are certain things that we can do to try and improve the chances of you actually carrying a pregnancy to term. So another complication that you can get from miscarriage would be a medical condition that happens after pregnancy, placental tissue diseases. So it's important to go for regular checkups after you've had the miscarriage, and for people to run certain tests just to make sure that you're continuing well. Also, if your blood group is negative and you have a miscarriage, it would be important to know your blood group so that we can prevent you from getting something that we call rhesus isoimmunization. Because once you have that, then there's a higher likelihood that you'll miscarry some of your other pregnancies. Okay, so miscarriage is a traumatic situation, especially if somebody knew they were pregnant and they were hoping for that pregnancy. So it's always good to be present for your relative, to support them, just to be there for them. And to be somebody who they can talk to about it, or at least to provide a situation where they can talk about it to somebody. I think that's as far as it can get. And then also encouraging them. One miscarriage doesn't mean all your pregnancies would be miscarriages. So just to help them to get over that loss would be a good thing. Immediately after the miscarriage, then normally we would give the patient some time off. Varies from about 1 week, 2 weeks, maybe longer, depending on what the patient's condition is. So that in that way, it will affect your life. Also, in terms of the psychological effect of going through a miscarriage, it would definitely affect your life. So it's always good to get that support, to have somebody to talk to about your feelings, about what you've gone through. Thank you for engaging with us in this episode. You can book my services at ponea.com. I look forward to engaging with you in the future.